Right now, your kidneys could be quietly failing without you even realizing it. Each year, nearly 850 million people worldwide are affected by kidney disease, and shockingly, close to 80% of those in the early stages don't know their kidneys are deteriorating. These small but powerful organs filter around 60 gallons of blood every single day, and when they begin to break down, the body starts sending signals that should never be ignored. In this video, we'll uncover 13 critical warning signs that your kidneys are in danger, symptoms that many people mistake for stress, fatigue, or simply getting older. Before we dive into these life-saving signs, if this is your first time here, you've just joined a community dedicated to helping you transform your health with knowledge backed by science. Tap that like button if you're ready to take charge of your well-being, and make sure to subscribe, because we're bringing you content that could mean the difference between catching disease early and facing permanent damage. Share in the comments where you're tuning in from. We love hearing from our global family of health-conscious viewers. Now let's begin the countdown of the 13 early signs of kidney failure, starting with the very first, fatigue and weakness. 1. Puffiness around the eyes. You wake up, look in the mirror, and see swollen lids that make you appear tearful or unrest. It's easy to blame allergies or a late night, but persistent morning eye puffiness can be an early red flag for kidney trouble that warrants prompt attention. The skin around the eyes is unusually thin and delicate, making this area prone to holding fluid. When the kidneys begin to lose their ability to filter proteins correctly, albumin and other vital proteins escape into the urine instead of remaining in the bloodstream. This loss of protein upsets the body's fluid equilibrium, allowing fluid to seep out of blood vessels and pool in the tissues, most noticeably around the eyes. Timing matters. The swelling is typically most apparent first thing in the morning, because fluid tends to accumulate while you're lying flat during sleep. 2. Metallic taste in the mouth. A peculiar, cling-like flavor that makes every bite taste as if it's brushed with loose change or tinfoil can turn eating from enjoyment into dread. This lingering distortion isn't merely a nuisance, it's a signal that waste products are circulating in your blood. According to the National Institute of Diabetes and Digestive and Kidney Diseases, uremic toxins can directly disrupt the taste buds and the sense of smell. The result is a persistent metallic or ammonia-type taste that makes food deeply unappealing. Some people describe it as constantly tasting blood or fine metal filings. The consequences are significant. When everything tastes awful, people naturally eat less, setting the stage for malnutrition and unintended weight loss. The same toxins often produce an ammonia-like odor on the breath as they are expelled through the lungs, reinforcing that this taste change is a systemic warning, not a simple quirk of the palate. 3. Changes in urination. Your urine serves as a real-time snapshot of your kidney health, and noticeable changes can be an early red flag. One of the most concerning signs is urine that appears persistently foamy or bubbly, resembling beer froth that doesn't clear away quickly. This effect is usually caused by protein leaking into the urine, a condition known as proteinuria. Under normal circumstances, healthy kidneys prevent essential proteins from escaping the bloodstream, but when the filters are damaged, they allow these proteins to spill into the urine. Research published in the Clinical Journal of the American Society of Nephrology identifies proteinuria as one of the earliest markers of kidney injury. Another worrisome shift is nocturia, or the need to urinate multiple times during the night. Studies indicate this often reflects the kidney's declining ability to properly concentrate urine. In addition, changes in urine color should never be ignored. Dark, cola-like urine or urine tinged pink may signal the presence of blood, an urgent sign of potential kidney damage. Just as important as the type of change is how often it happens. The persistence and timing of these urinary changes provide critical insight into the health of your kidneys and should not be overlooked. 4. Loss of appetite and weight loss. Imagine sitting down to enjoy a dish you've always loved, only to discover you have no interest in eating at all. Or maybe the people around you keep pointing out that you look noticeably thinner, even though you never intended to lose weight. While dropping pounds might sound like a positive change, when it's linked to kidney disease, it signals something far more alarming. Your body is overwhelmed by toxins that are disrupting even your most basic survival instincts. According to research in nutrition and clinical practice, appetite loss in kidney disease goes beyond simply not feeling hungry. It's driven by complex metabolic changes caused by the buildup of uremic toxins. These waste products disrupt the body's normal hunger signals by lowering ghrelin, the hormone responsible for stimulating appetite. At the same time, they trigger inflammatory substances that tell the brain to cut back on food intake. The outcome is a sharp decline in appetite that often leads to unintended weight loss and muscle wasting. This creates a dangerous cycle, because when the body isn't properly nourished, kidney disease tends to progress even faster. 5. Dry, itchy, and flaky skin. If you've noticed your skin becoming unusually dry, rough, or itchy, even though you apply moisturizers and drink plenty of water, it may be more than just a surface-level issue. Persistent skin problems can sometimes point to hidden internal imbalances linked to declining kidney function. The skin often mirrors what is happening inside the body, and when the kidneys begin to fail, that reflection becomes clear. Research in the International Journal of Dermatology explains that healthy kidneys are essential for maintaining the delicate balance of minerals, vitamins, and nutrients that keep skin vibrant and healthy. Once kidney function declines, this balance breaks down. Impaired kidneys are less able to regulate phosphorus, which disrupts calcium-phosphorus interactions vital for normal skin cell activity. In addition, kidney disease commonly results in deficiencies of nutrients like vitamin D and B vitamins, both critical for skin health. Chronic inflammation that accompanies kidney disease further disrupts collagen production and reduces skin elasticity. Over time, this combination of nutrient loss, mineral imbalance, and inflammation manifests outwardly as dry, flaky, and irritated skin, revealing the deeper struggles occurring within the body. 6. High blood pressure. Your readings keep edging upward, and even prescriptions don't seem to rein them in. Although hypertension may appear separate from kidney issues, the two are tightly interwoven. Trouble in one almost inevitably destabilizes the other, creating a feedback loop that can hasten organ damage. Findings reported in the journal Hypertension show that the kidneys are central to blood pressure control through several pathways. They regulate the amount of fluid circulating in your vessels, release hormones that influence how those vessels behave, and maintain a careful balance of sodium and potassium. When kidney function declines, these controls falter. Impaired kidneys fail to clear excess sodium and water, expanding blood volume and pushing pressure higher. At the same time, diseased kidneys often secrete too much renin, tightening blood vessels and driving the numbers up even further. 7. Poor concentration or brain fog. You step into a room and suddenly can't remember why you went there. You reread the same lines and nothing sticks, your head feels muffled, as if wrapped in cotton. This mental haze isn't simply stress or ordinary aging, it can be a red flag that circulating toxins are impairing how your brain works. Research reported in the American Journal of Nephrology shows that when the kidneys fail to clear waste efficiently, those byproducts spread throughout the body, including the brain. Uremic toxins can cross the protective blood-brain barrier and disrupt normal neural function, producing what clinicians call uremic encephalopathy, marked by problems with memory, attention, and cognitive processing. Importantly, studies indicate that even mild kidney impairment is linked with measurable declines in thinking skills. In other words, this kind of brain fog may be an early warning sign that should not be dismissed. 8. Muscle cramps. You're yanked out of sleep by a sudden, knife-like spasm, the kind that makes a muscle feel as if it's ripping. These aren't the usual post-workout twinges. They're tougher, show up more often, and can strike even when you're doing nothing at all. When cramping keeps returning, especially in the calves or feet, it can be a signal that the kidneys are failing to keep your minerals in check. Findings reported in Kidney International reports note that healthy kidneys finely tune the levels of key electrolytes, sodium, potassium, calcium, and magnesium, in your blood. As kidney function declines, this delicate equilibrium falters, and the resulting imbalances frequently surface as painful cramps. Low calcium can provoke intense, stubborn cramping, while dangerously elevated potassium may trigger life-threatening disturbances in heart rhythm. The spasms often begin in the legs and feet, then can spread to other muscle groups throughout the body. 9. Persistent itching. A relentless, deep-seated itch that refuses to let up, no matter how hard or how often you scratch, can feel like torment. This isn't the occasional irritation from dry skin or a seasonal allergy. It's a whole-body misery that can push people to the edge. Evidence reported in clinical nephrology indicates that this kind of unyielding itch affects as many as 90% of individuals with advanced kidney disease. When the kidneys can't clear waste efficiently, substances such as urea and phosphorus accumulate to toxic levels in the bloodstream. Those circulating wastes stimulate nerve endings throughout the skin, creating an intense, from the inside out itch and persistent discomfort. Phosphorus overload also disrupts calcium metabolism, encouraging calcium-phosphorus deposits within the skin that amplify the itching even further. That's why typical anti-itch remedies often fail. The problem isn't on the surface of the skin, it's rooted in abnormal blood chemistry driven by impaired kidney function. 10. Nausea and vomiting. Waves of queasiness that arise without a clear trigger, a disappearing appetite, or a sudden dislike for foods you once enjoyed can be your body's alarm that something toxic is building up inside. When the kidneys no longer clear waste efficiently, those byproducts accumulate in the bloodstream, a state known as uremia. Findings from the National Institute of Diabetes and Digestive and Kidney Diseases show that uremic toxins disrupt the digestive system on multiple fronts. They irritate the lining of the stomach and interfere with appetite-regulating centers in the brain, producing persistent nausea, bouts of vomiting, and a profound loss of interest in eating. This isn't a brief stomach bug, it's the body reacting to waste that should have been filtered out. The nausea often comes in surges and tends to intensify over time as kidney function continues to deteriorate. 11. Shortness of breath. You take the same stairs you've used for years, and by the time you reach the top, you're gulping for air. Everyday tasks that once felt effortless now leave you winded and drained. While it's natural to suspect a heart or lung issue first, your kidneys may be the hidden reason you can't catch your breath. A large study in the American Journal of Kidney Diseases following more than 4,000 patients identified breathlessness as one of the most frequently reported symptoms. Two major mechanisms explain why. The first is anemia. When kidney problems reduce your red blood cell count, less oxygen is delivered to your tissues, so even mild activity feels taxing. The second is more alarming. When diseased kidneys fail to clear excess fluid, that fluid can back up into the lungs, causing pulmonary edema. With fluid filling the air sacs, oxygen has a harder time passing into the bloodstream, creating the terrifying sensation of suffocating from the inside. 12. Swelling in feet and ankles. Your shoes suddenly feel tight and the cuffs of your socks carve deep grooves into your ankles. Many people chalk this up to a long day on their feet, but ongoing swelling in the feet and ankles may be your kidneys raising an urgent warning. In healthy conditions, the kidneys act like finely tuned filters, keeping fluid levels in check by clearing excess sodium and water into the urine. Evidence from kidney care research shows that when these filters are damaged, they can't remove extra fluid effectively. The result is edema, fluid leaking out of blood vessels and pooling in tissues, most noticeably in areas where gravity draws it downward. What makes this particularly worrisome is how it lingers and advances. Unlike brief puffiness after a salty meal, kidney-related edema doesn't fade overnight. As kidney function deteriorates, the swelling often worsens, creeping up the legs and at times involving the hands and face. 13. Fatigue and weakness. You open your eyes after what should have been a restful night, yet an overwhelming heaviness follows you into the day. By mid-morning, you're already on your third cup of coffee, still wondering why even the simplest tasks feel draining. This isn't ordinary tiredness, it could be your kidneys sounding an alarm. As kidney function declines, toxins begin to accumulate in the bloodstream, creating a harmful environment that weighs down every system in the body. One of the most damaging effects involves oxygen delivery. Healthy kidneys release erythropoietin, a hormone that tells the bone marrow to produce red blood cells. When the kidneys are impaired, this hormone decreases, leading to fewer red blood cells and reduced oxygen flow. Research published in the American Journal of Kidney Diseases shows that anemia affects as many as 60% of individuals with chronic kidney disease. With less oxygen reaching the brain and muscles, the result is constant exhaustion that no amount of rest seems to fix. Too often, this fatigue is brushed aside as stress or simply getting older, but in reality, it is one of the earliest warning signs of declining kidney health. These 13 signals are not random aches or inconveniences. They are your kidney's urgent cry for help, a final push to get your attention before the damage becomes irreversible. Whether it's the relentless fatigue that drains your strength, the mental fog that makes it hard to focus, the swelling that alters the way your clothes fit, or the skin changes that reflect deeper imbalances, each one is a critical chance to act early. What makes this knowledge so powerful is understanding that kidney disease is often nicknamed the silent epidemic, because warning signs usually remain hidden until nearly 70% of kidney function has already been lost. But now you know what to look out for, which means you're no longer among the 80% of people who overlook these early red flags. Detecting the problem in its earliest stages can slow its progression, or even prevent it altogether. And the sooner it's identified, the wider the range of treatments available to protect your health. If you recognize several of these symptoms in yourself, don't ignore them. Book an appointment with your doctor right away and specifically raise concerns about your kidney health. Just 2 basic tests, a blood test to measure creatinine and estimate filtration rate, along with a urine test to check for protein, are enough to uncover kidney disease early, when interventions are most effective. If this video added value for you, type the word value in the comments to let us know. It keeps us inspired to bring you more. Don't forget to hit the like button, share this message with someone who may need it, and subscribe for more life-saving health insights. Thank you for dedicating time to your well-being, and remember, knowledge isn't just power, it's protection for your future.